Okay, let's start. This is a recording for the Occupational English Test. The test is held in the CBLA office, Melbourne, 20th of February. The candidate name is Mary. The candidate number is 2019-58-1. The interviewer is Sally Smith and the interlocutor number is 123456. The role play numbers are 1 and 2. The profession is nursing. Good afternoon. My name is Sally Smith. Can you state your full name, please?
My name is Mary Hafiz and my number is 200019581.
Great. You're taking a test for nursing, is that correct?
Yes, that's right.
Great. Thank you. Can I see your identification document, please?
Here you go.
Okay, so please confirm your details are correct on the test paper and then read and sign the candidate declaration on the front of your booklet. Okay, thank you. I'm going to be working with you for this test. There will be warm-up questions followed by 2 role plays. Remember that this is a test of your English, not your professional knowledge. Please speak naturally. Do you have any questions about this?
No, thanks.
Great. The warm-up questions are not assessed. It's a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes. So I'd like you to tell me about your professional background. So why did you decide to become a nurse?
I just like to help. So I like helping people. So I feel like it's good for me to be a nurse so I can help people and take care of their health. Yeah.
And what kind of a person makes a good nurse?
I think there is 2 main things, active listening and caring. Yeah, to be a good nurse you have to have these kind of things.
Excellent. And tell me about a usual day in your job.
I didn't work yet, but in my placement, when I see people laughing and they become healthier and more relaxed in the hospital environment, I feel like this is a good day for me. Yes.
Excellent. And what's the best thing about your work?
When you see people becoming healthier and more relaxed and more happier, and they getting better by time. So I think this is the best thing. Yeah.
Thank you. Let's move on to the role plays now. So I'll take the part of the patient or perhaps a relative. You'll take the professional role. So each role play will last 5 minutes, and the purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, thanks.
Excellent. Okay. So you have up to 3 minutes to prepare the first role play. You will start the role play after that time. You'll know when 3 minutes are up. You can ask me if there's anything you're not sure about, and make notes on the role play card. If you want, there's a pencil for making notes. You can look at the card during the test, but must return it to me at the end of the test. This is your information for the first role play, and the role play number 1 for profession of nursing. Please start preparing now.
Thank you.
Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play now?
Yeah. Hi, my name is Mary. I am one of the nurses from the hospital. I came today because the doctor needs you to start insulin. So what do you feel about that?
Well, to be honest, I'm a little bit nervous about the idea of starting insulin injections.
Okay. I can understand it's really new for you to to inject yourself with insulin, but I'd like to reassure you that it's easy and it's straightforward. So I will explain to you how to take the injection, and you will be fine. So, yeah.
Is there any other way? Is there another thing we could possibly do?
About the diet and anything oral tablet, I think it's not the good option for you at the moment, because your the diet is not controlling your the sugar level in your blood. So the insulin injection is the best option for you at the moment. It will control your blood sugar level and bring your blood sugar level at the normal level for you. So I want to reassure you that it's very easy to take insulin injection, and I can explain to you how to take it. So can you let me to tell you?
Yes.
So in the beginning, you will take the insulin injection. You open it and check the correct dose and the date of the on the needle, and if it's right and if it's the right dose, the doctor tell you, and then you check on your tummy. So choose any spot you like, and then try to squeeze your tummy like this, and then put your needle. But I would like to explain that you need to change the spot. So you don't use the same spot for every time. So you need to change the spot. One time here, one time there, so you don't have the bruising and this kind of painful area. Yeah. So what do you think about that?
I mean, I guess, as you say, I have to, because my diet isn't working to control my insulin. I still feel a bit nervous about it, but I guess I could give it a go. Yeah,
and the insulin injection will control the situation for you, and you will get healthier and better, and the insulin will help you get better and improve your condition, make you feel healthier and good again. Yeah.
Is it something I have to do for the rest of my life? I mean, that's, I guess, also something that I'm kind of nervous about.
Yeah, you will take this injection, and the doctor will keep an eye on the blood sugar level. So you will have to do a test for every couple of months or something like that. The doctor will tell you exactly, and then you will check your blood sugar. If one stage your blood sugar will become normal again, so maybe the doctor will explain to you another option. But at this stage, you need to take the insulin injection to help your condition. And I would like to stress the importance of disposable to throw the needle in this container. I bring yellow container for you. So after you finish the injection, you put the needle inside this container, and when it's full and you don't put any other needle inside it, go to the local pharmacy and then change this yellow container. They will give you a new one, and they can take the old one from you. Yeah, so you will not injure yourself or any of your family.
I see. And what happens, because I am still a bit nervous about the injections, what happens if I freak out and, you know, I can't inject myself?
I can understand it's very stressful because it's your first time, but I would like to reassure you that you will get use of it, and you will know how to do it by time. It will become natural and you can do it easily. So just try now, and I will try with you for the first time, and then so you can know how to do it by yourself. But I would like to assure you that it's straightforward and it's easy. You will get use of it, and you will know how to do it. Yeah. At the end, I would like to summarize what we have discussed today. So the doctor needs you to start insulin injection, so to control your blood sugar level. So you will find a spot in your tummy, put the injection inside your tummy, and then put the needle inside this yellow container, and when it's full, take it to the local pharmacy and change it for a new one. Do you have any question for me today?
No.
Is that clear for you?
Yes. And thank you. That's the end of the first role play.
Thank you.
Let's move on to the second role play. Again, you have 3 minutes to prepare. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want. You can look at the card during the test, but must return it to me at the end of the test. This is your information for the second role play. And the role play number is number 2 for profession of nursing. Please start preparing now. Thank you. The role play will now last about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Hi, my name is Mary. I am one of the nurses here today. How are you?
Look, I'm really a little bit angry, to be honest. Yeah, I've been waiting for an hour to see a doctor and no one's come to talk to me yet, and yeah, I'm really frustrated.
Yeah, I can understand your concern. It's really stressful when you wait for a long time, but as you can see, and I would like to explain to you that all the doctors are busy at the moment. They are looking for other patients who have a really serious and urgent condition at the moment. So when the doctor, they are free, they will come and look after your child.
Okay, but I think the reason that I'm so agitated and so angry is that, you know, my child is quite sick as well. So, you know, I'm really worried that my child has asthma, and I know that that's a really serious condition. So, yeah, I really need to see a doctor.
Yeah, so can you tell me, please, you mentioned that your child is really sick. Can you tell me what happened to him? What is his symptoms?
Sure. So my child is 3 years old, and he's been wheezing, he's had chest tightness, and he's had difficulty breathing. So I looked up on the internet, and those are all signs of asthma, so I'm really worried.
Oh, okay, I can understand, very stressful when you have a sick child, but
Yes.
can you let me to do his vital sign to check his condition?
Is it possible that I could get a doctor to come and do that now?
Yeah, I know you need a doctor, but as I explained to you, all the doctors here are busy at the moment, and when they are free, one of the doctors will come and look after your child. And I would like to explain to you, when the doctor come, they will do some tests, so it will take time for them to figure out what happened with your child, what the problem is. So I would like to reassure you that I think your child your child condition is stable at the time. So if you let me take the vital signs until the doctor come, to make it faster and easier for the doctor when they come. So what do you think?
Well, I guess it's, you know, I don't really have a choice, but I really, when you take the vital signs, I really want you to tell me if my child has asthma or not. Okay.
I know it's hard for you to relax, but try to relax and let me take the vital signs, and I will tell you what I found in the vital signs. Yeah, that's all I can do at the moment until the doctor come and figure out what the problem is.
Well, okay, I mean, I guess you can take the observations, but yeah, I'm really frustrated that I can't know that if my child has asthma or not.
Yeah.
I really wish you could tell me.
On my experience, I think his condition is stable, so I don't think it's asthma, but we will take the vital signs and we'll wait for the doctor. When they are free, one of them, they will come and look after your child. But for now, can you let me take the vital signs?
Okay, go ahead.
Thank you.
Thank you. Thank you. That is the end of the second role play. Can I please have your role play page?
Yep.
Okay. We will now check the recording. We have confirmed that the test has been recorded successfully. Thank you very much.